Hello and welcome to Health Affairs This Week. I am your host, Jeff Byers. Today we are talking about cybersecurity, the recent CrowdStrike and Change Healthcare events, while separate cybersecurity issues highlight how our personal health data security can be beholden to companies and their platforms. But before we get into today's episode, I wanted to note Health Affairs released 2 ahead of print articles this week. First, we have our first report from our Eye on the IRA series, where Laura Tolan evaluates the first round of Medicare drug price negotiations. The second comes from Benedict Ippolito and Joseph Levy. They share that expanding Medicare coverage of anti-obesity medicine could increase annual spending by $3.1 billion to $6.1 billion. Both are open access and available currently online. Here today to talk about cybersecurity, Leslie Erdelack is back on the program. Leslie, welcome back.
Hey, Jeff.
You excited to talk about cybersecurity?
I'm ready.
Have you gotten any notifications that your health data has been breached by any organizations?
All the time, it feels like.
Yeah. That's not a good thing, right?
No. Should I be more worried?
I don't know. I'm not a cybersecurity expert, but I'm just here to learn just as much as the next person. Speaking of being worried, how common are cyber attacks on healthcare data? That was a great transition. I want everyone to acknowledge that.
Yeah. Okay. So I wasn't joking. They are really common, and you do hear about healthcare data breaches and other incidents all the time. So yeah, it's a big deal. And last year, more than 133 million patient records were exposed. And actually, I did some digging. The HHS Office of Civil Rights actually publishes summaries of healthcare data breaches on its website. And if you go on there, you can see all this information. That's where that estimate's from. And that number has been going up year after year with breaches that are stemming from hacking and IT incidents, which include things like ransomware and phishing attacks. Those types of attacks make up about 80% of all reported security breaches out there.
I have received your personal information has been exposed by some healthcare companies. I don't want to brag about that. I'm just saying my information might be out there. So that's fun. And what it makes me think about is, why is healthcare data targeted in the first place?
So all of that sensitive and personally identifiable information that we give to our healthcare providers, yeah, it's extremely valuable and it's really attractive to the people out there that are looking to exploit that. And as I understand it, stolen health records are actually a lot more lucrative than stolen credit card numbers. You can't just deactivate or turn off your health records. And so healthcare facilities are vulnerable to cyber attacks because they not only store a lot of valuable information, but they're running on these older systems. They have older software. It's a really difficult environment to secure. And then there's also the pressure for hospitals, as you might imagine, to get their systems back up and running as soon as possible. It's making them arguably a lot more susceptible to making these ransom payments and other types of demands than other institutions. And so, kind of full circle, they're actually more likely to be targeted.
And this is generally an area that we don't talk about that much on this show. And I'm not sure how much we talk about it in the pages of Health Affairs, but there have been some incidences in healthcare and outside of healthcare that have affected the healthcare industry that just wanted to point out where I think our listeners might be able to learn from this. So one of them was earlier this year in February of 2024. There was a ransomware attack on Change Healthcare. And Change Healthcare is, and I don't want to get it wrong, but they're owned by United Health Group. And I believe they're a revenue cycle management focused company. Either way, they have a lot of data on a lot of customers. And they went through a ransomware event. And I don't have the exact numbers, but it affected a lot of individuals. And they recently started sending out notification letters. And I wanted to ask you, Leslie, what can this ransomware attack on Change Healthcare tell us about the healthcare system?
Yeah, I think for one thing, it just, again, like it reinforces the healthcare system's vulnerability to cyber attacks. And it's not so much that healthcare organizations are not willing to make investments to secure their operations, though there was a clear lapse in this particular incident, as we've sort of found out. But generally speaking, I think it has to be hard when you look at the size and the scope of an organization like United Health Group. I mean, this story got so much attention. I think it has to be hard to sort of put yourself in their shoes to be able to prioritize which vulnerabilities in their systems pose the most practical and immediate risk. And so I'll just point out, two of my observations about our healthcare system that kind of surfaced after the Change Healthcare attack. And a lot of people have already pointed this out, but it's another example of the risks of consolidation in healthcare. So you mentioned this. United Health Group acquired Change Healthcare in 2022, and so the reach of these organizations is so big. Together, they touch so much of the U.S. healthcare system, and they're so interconnected and so centralized that it really creates just a single point of failure. So, what are the risks of being targeted for a cyber attack, and what would the potential fallout be? This is yet another thing that I could see regulators starting to think about when they're deciding whether or not to approve mergers like this in the future. And then second, and this is just kind of basic, I think this incident also showed us that it's important for health systems to have business continuity plans. This isn't just having a plan to get your hospital operations and services back online, but this is about having alternative payment and collection systems too, so that you don't have cash flow problems like we saw here. And I'll just point out, I saw a survey by the American Medical Association that said, a lot of clinicians lost revenue. A lot of them had to use their personal funds to pay bills. And for smaller and more rural physician groups in particular, I think this is a really tough deficit to recover from. So whether it's a business continuity plan or whether it's another arrangement, I think the Change Healthcare attack should really force us to think about measures that should be in place that would allow practices to protect their financial stability so that they can keep seeing patients.
Yeah, thanks for that. And on the business continuity and kind of shifting gears to the CrowdStrike event, which is a little bit more recent. I can't remember the exact date, but I think it was in June or July.
Just last month?
Last month. Yeah, time. What is time?
Yeah.
Yep, it happened in the summer of 2024, and the incident essentially affected a fair amount of businesses to not be able to continue operating at the level that they would. I heard reports of hospitals around the country and here in Richmond canceling elective surgeries, for example, which might have some downstream effects on operational and revenue. What can the CrowdStrike situation, which is not a ransomware situation, what might this tell us about cybersecurity?
Yeah, so it was a global outage. We know it affected businesses that run on Microsoft. You mentioned that some health systems had to delay procedures. It also affected the platform that supports electronic health records. So any clinical documentation had to be done on paper. So, the other thing too is without access to the EHR, it's really hard to confirm what medications a patient's on or what they're allergic to. So it created administrative burden along with patient safety concerns. But I thought the interesting thing was that the extent of the disruption it really seemed to vary both within and across healthcare systems. Some were just more getting back to sort of the business continuity angle, some were just more prepared than others, just more agile. And the other thing that we know is that even though the outage affected a lot of different sectors, the healthcare industry actually suffered direct losses to the tune of about $2 billion. So that's more than the banks, more than the airlines. So it did have a significant financial impact as well. And I agree with you. I think some of those downstream consequences have yet to be felt.
So from what you can tell and what you've been researching on this, are there any preventative measures that providers can invest in for this?
Yeah, I think of course there's always the material investments you can make, right? You can mitigate cybersecurity risks and install security technologies like multi-factor authentication as kind of a standard protocol. But it's always, I think, going to be a trade-off between implementing these security features and then, especially in the healthcare arena, putting those dollars toward things like medical equipment. And again, I think back to small rural practices. Money and staff are two things that just historically those types of organizations often lack. So then I think from a policy perspective, there's always this idea of incentives. Can you design some incentive for healthcare organizations to invest in a minimum package of cybersecurity protections? Maybe subsidies could help level the playing field for those rural and safety net hospitals to kind of help offset the cost. And I don't think the expectation should be for all healthcare providers to, be chasing these best in class systems. I don't know that that's appropriate for everyone, but I think we should be looking at the third party vendors that clinicians, that health systems rely on, and make sure that they are adequately prepared to respond to cybersecurity threats.
Well, thanks, Leslie. I think that's about all that we have time for today. Thanks for sharing what you researched on cybersecurity with us related to these recent events.
Yeah, it's a really interesting and complicated topic. Lots of activity.
Very complicated, but thank you for breaking it down for us. And to you, the listener, if you enjoyed this, please send this to the person that needs a password manager in their life, and make sure you subscribe to Health Affairs This Week. Thanks.
Thanks, Jeff.